Okay, so this assignment we were to pick a family who we are following in our practicum, and we were supposed to go through the list of steps, the assessment of the family system, the presenting problems or symptoms, a treatment plan with goals and objectives, and the theory used, the diagnostic information where appropriate, intervention techniques used, and evaluation of techniques and the case course. I just kind of put like the evaluation of the case as a whole. So the first is the family system. So I have a nice little drawing here. So we have the mom. Here is the client who I have been seeing since I started at Wilson Counseling in August. He is now 12. And then on this side is dad and stepmom. And so mom and dad have been separated for approximately 10 years. And shortly after they were separated, he started seeing and then married stepmom. And stepmom and him are still together. And they have been doing, don't laugh because I'm a mom and I have to make this work. So I'm sitting in the bathroom floor. Um, so I put up here the DCBS case because actually it's been close to 2 weeks ago. Sarah, who is my supervisor, who I've been shadowing, she had to report an incident on this case. So that's all I can say, really. So we're just saying, what will happen and where will he go? He has all these questions. Are visits with mom going to stay the same? So that is his family system has been a little bit uneven. He does see mom every other weekend if she doesn't work, unsupervised from Friday to Sunday, or sometimes from Saturday morning to Sunday at her home. So that's his family system. And so the next is presenting problems and symptoms. And so I have the new investigation, which I just discussed. Nothing's happened so far right now. So that's still up in the air. And then what Sarah has been discussing with his biological father and stepmother is what is appropriate punishment. Unfortunately, the client and his father disclosed that he has gotten in trouble before and had to pick up dog poop out of 3 different yards in the same day. And so he also reported that a while back his dad made him hold hot sauce in his mouth from Morgantown to Bowling Green. And that was reported a long time ago, and that was already handled in court. So the main problem right now, I feel like Sarah and I are working with the client, is does the child feel safe? And right now he doesn't. He doesn't feel safe. He said that he would feel better if he were somewhere else, and not even if it wasn't with his mom or his dad. So the next thing would be the treatment plan with goals and objectives. The first goal I had down would be to reduce frequency and duration of his anxiety. And the second goal would be to learn and implement coping skills to improve his living. Here, after I go over his treatment plan, I do have his diagnostic information. So the objectives I have down here for him on his treatment plan would be describe thoughts or situations where the client feels anxious. The intervention for that objective would be to build rapport and ask where the client has felt anxiety in their past or where they are experiencing that currently. His next one would be the objective would be to express his feelings through art, because the client has expressed his love for drawing race cars, and any way that he is feeling, he likes to put that on paper and draw a monster or something like that. So his intervention is to complete a color wheel with at least 5 feelings. So we've done this before, and we've said, well, this week, what have you felt like? What are 5 feelings that you've experienced? And then in that pie graph that you draw, color in how much of it you felt that certain way. And then we go over why he experienced those feelings. The next objective would be to verbalize when art is not possible. And his intervention would be one-on-one time with either biological father, biological mother, or even if he felt like he could or wanted to talk to his stepmother, he could do that as well. So his diagnostic information. Sarah currently has him diagnosed with GAD, generalized anxiety disorder. Right now, I kind of put on here, this is kind of me. I'm not really an artist, but I'm kind of sad right now because I don't know if he's going to be going to foster care. He doesn't know if he's going to be going to foster care or if he's going to have to stay here, and what repercussions will happen, or if there will be repercussions. This will equal an adjustment time either way, if he stays at home or if he goes to a foster home, if he has to change schools, if he'll be able to stay with Sarah as a therapist. So I put distressed relationships possible. So unfortunately, I feel like it might take time away from him seeing his biological mother. Who knows if the visits would stay the same or what would happen. So, and then the theory used. So my nice little drawings here again. So I have dad and stepmom on this side, and then mom over here. And so with those 3, Sarah and I have been doing more reality therapy with them because they need more straightforward talk, because they're just not beat around the bush people. They need it, just tell me straight up. And then I have on this side therapist and client over here, therapist and client, and we're like sitting at a table playing games. And I put play like therapy games. He likes, recently we've been working on some anger issues that he's been experiencing. So we've been doing a card game called Mad Dragon. And it's kind of like Uno, because you have to match the colors or the numbers. And then on some of the cards, it has questions on there where you have to say when you felt this way or experienced this, and then what you would change or what you've learned from that experience and would do different next time. So he's really enjoyed those games like that, and then the color wheels and stuff. So, and then lastly, I have my evaluation. So I put on here what is going to happen. Like I said, will he still get to see the same therapist? Because that's a huge deal. Who knows if he'll get to see Sarah, and then will he connect with his next therapist if he has to change like that? And it's kind of hurtful for him, having to retell his story to somebody new. So maybe he can have some sort of stability during this time. And then I put, will his parents do what they need to do? Will they follow their care plan, their case plan that they need to do X, Y, and Z to get him back, or to have their case closed? And then will there be behavior changes for the good or bad for him? He said he would feel safer if he wasn't at that home. So maybe behavior wouldn't be an issue. Maybe he would be a better child. Maybe he would express his feelings more if he was somewhere else. Um, he feels safe in the therapy office, and so I really hope he can stay with Sarah. So this case has been a really good one for me to follow. He actually started um, like 1 month before I started at Wilson Counseling. So um, that's the case. Thanks.